just underneath the blue ones, it shows that, our top 9 plans from our competitors, they're also growing, but they're growing at a loss generating net healthcare results. So what that means is that in future, these competitors will be in a critical position where they would need to make future pricing corrections in order to, be in line with medical inflation as well. So let's just also quickly look at our membership base. Our membership base has been doing exceptionally well due to the fact that we haven't seen, a significant number from 2020, which is prior to COVID-19, during COVID-19 and post-COVID-19, in terms of upgrades and downgrades, where there is a stability in plan choices and a stability in lapse rates of 5.2%. So what that means from a medical aid point of view is that the type of benefits and services that we render to you as our member is coming across as affordable, and it caters for your medical necessities, as there is a stability in plan choices as well. Like I've initially said, from the beginning of my slides, that we are currently in a strong position as a medical scheme, as our solvency rate is currently sitting on 36%. And as per the South African Medical Association, your solvency rate ought to be 25%, right? And we're AAA credit rating. So I'll also be taking you in depth in terms of, what is it that we are planning to do as a medical scheme to go back to a solvency rate of 25%? And how are we planning to do that by giving back to you as our member with the new plan types that we have implemented, as well as, programs that we've also implemented as well. So there are 3 pillars that, contributed towards us, being in this position in terms of affordability and sustainability and benefits for 2022, where we were capitalizing on the strong Discovery Health operating performance to balance those 3 subcategories. So looking into this slide, this is a contribution strategy slide, right? When you look at the left-hand side of the slide, there is a graph that, reads Discovery Health medical scheme contributions relative to claim. So when you look at January 2019, right, it shows that our contributions were in line with our claims, contributions being in yellow and claims being in black. And then fast forward to January 2020, right, our contributions have also been, in line with our claims, but there has just been a slight change here. There's just been a slight difference here, right? And then when you look at March 2020, when we experienced the first wave of COVID-19, we saw a high number of discontinuity, right? So what that means is that, every one of us on this call has somewhat, experienced COVID-19 as we were forced into a lockdown. So a lot of people were skeptical into going to medical, facilities to seek for medical attention. And, we were all under lockdown. So people were not claiming as we would have anticipated as a medical scheme, right? And with that being said, as a medical scheme, we decided, let's just leave contributions as they are until we're able to balance, affordability for our members, because it wouldn't have made sense when, we've accumulated so much of high reserves and we still, increasing our contributions. So this is one of the main reason why we haven't increased our contributions for the last 16 months, right? And fast forward to October 2022, that's when we recently implemented our new increase of 0.3% gap between claims and contributions, right? And then when you look at further to the right-hand side of this presentation, where it reads actual claims versus expected claims, right? So you can see here what, that discontinuity has done to the amount of claims that were ought to be put through to our end, right? And then fast forward to October, we can see that essentially our claims are going back to normal as we would have anticipated, right? So since we have implemented a recent increase from the 1st of October, and we are seeing that, the volatility within the economy is working in our favor, because I think over and above our central focus as a medical scheme, and as, our actuaries, is to determine and also price our pricings with, accurate pricing. So this is one of the strategy that we have implemented of deferring, and it, essentially worked in our favor, right? So what does this mean? So this results to immediate affordability. So with the 6.8 billion of excess reserves, or the 5,000 per average policy, this is what was saved worth of contributions in 2021 and 2022, because there wasn't any increase for the past 16 months, right? And we've increased our recent increase with CPI plus 0.2%. And you can see that, our pricing strategy has been actually accurate, as opposed to the industry where the next 6 open lodger schemes where they've increased their increases with CPI plus 0.7%. So we're not in a critical position where we would need to make future price corrections. When you look at the further right of this presentation, you are going to see how accurate Discovery Health in terms of lower increase has been, with with our pricing strategies and so forth. And then when you look at the right and the what's this, the red line, it clearly shows you that, had we increased our increases with CPI plus 0.7% or anything beyond 0.2%, that would have resulted in member price shock, because we would need to realign, medical claims and contributions as well, which is a very critical stage where one wouldn't want to see themselves in, right? So what does this mean for you, right? And what does this mean for us? Before we get to you, let's speak about us, right? Because there's a high volatility within the economy concurrently, and economists can't also determine what our CPI will be, right? We as a medical scheme took a decision to say, fine, we are seeing that continued utilization is slowly but surely going back to normal. But what we are going to do is we are going to defer our increases. And one of the main reasons why we're deferring is because of the high volatility within the economy. So we don't know what the CPI will look like for the next year. So what we're saying is, yes, we have increased our contributions from the 1st of October 2022, but we are not going to increase our contributions from the 1st of January 2023. What we are going to do is we are going to defer the increment to the 1st of April 2023 with CPI plus 3 to 4%. This will also assist you as a member and ensure that contributions match to claims, right? Because what we are trying to do, our ultimate goal is to go back to our old traditional way of, increasing our increases in line with medical inflation from the 1st of January every year. Before I could move any further along, I just want to quickly get an insight from the floor T if there's any questions with regards to our contribution strategies.
No questions posted in the chat, so we can continue.
Sweet. Right. So this is practically our rollout plan, right? What is it that we are going to do from the 1st of January 2023? Because these are some of the questions that we've been getting from our members, concerned members, in terms of how will this, pan out, right? So what we're saying is from the 1st of January 2023, there is obviously going to be benefit enhancements effective. Benefit limits, co-payments, and deductibles will increase by 6%. And then the annual thresholds also increase by 9.9%, right? And then you will be obviously given a window period, possibly by the end of February, to allow you to accommodate the 1st of April, which means that from the 1st of April, we are going to allow for upgrades. There is going to be additional medical savings account allocation before the 1st of April 2023. For members that have already reached the above threshold benefit, before the 1st of April, we'll stay in the above threshold benefit. And the key care income bands increase in line with salary inflation, and there will not be any key care income verification. This will only be done over 2023 year end, right? So let's just quickly also look at our enhanced benefits in all key categories, where the oncology threshold has increased with 25%, a new disease prevention program that I'll be taking you in depth, as well as a new plan type that we have recently implemented. There's really not much that we have, updated from our end, right, to your existing plan types, right? But I think that's a conversation that you would have with, T and them BDO guys, where you would need to reevaluate your plan type and the type of benefits that are rendered to you, right? So let's just quickly look at the significance or the fundamental basics of being in a critical position where you're living with a certain condition, cardiometabolic syndrome, if I may put it that way, and you're not managing this syndrome, and how that can deteriorate your health, and that can compromise and put you in a position where you end up with a chronic condition that can't be managed at a later stage, right? And when you look at the life expectancy of an individual that's living with a cardiometabolic syndrome and they're not managing that efficiently, and you're also looking at a life expectancy of an individual that's living with a cardiometabolic syndrome, but that has been identified and is concurrently managed, they somewhat there's a slight difference in terms of, the probability of developing a further cardiometabolic syndrome. And when you look at the far left-hand side of this presentation, there is a practical example of, a 40-year-old living with a cardiometabolic syndrome. They've got low blood glucose, less BMI, and less waist circumference, where they've got a probability of 10.5 times of developing diabetes in the next 2 years, right? So the reason why I've shown you that slide is because, due to COVID-19, we as a medical scheme were in a critical position where we were not able to detect, any cardiometabolic syndromes because people were not, doing their health checks. People were not consulting as efficiently as we would have anticipated, right? But who's to blame for this, right? So we needed to come up with solutions to help you as our member. And we did that by, developing a proactive AI model, right? Which is the artificial intelligence model, where we've utilized a risk identification model. We've identified 25,000 members that are proactively at risk of developing cardiometabolic syndrome. And then we've also, with some funds from those excess reserves, right? Because remember, our ultimate goal is going back to the 25%. So with some of the funds that we got from our excess reserves, we've also created a basket of care, right? Which I'll be also taking you in depth with regards to. And then if you do form part of any ongoing management treatment, rest assured, this program will not, impact your ongoing management, whether it's chronic or HIV or whatever the case may be. Your doctors will, liaise with each other. And, if there is any medication that's prescribed for you to manage your cardiometabolic syndrome, we'll make sure that it's inclined with the current treatment that you're concurrently on, right? So from the 25,000 individuals that we have identified, our artificial intelligence model, helped us into developing these members. And what we looked at was members' health check results, a family history, claims pattern, plus demographics, right? And a practical example of one of the 25,000 individuals that have been identified would be a 59-year-old female who has a family history of diabetes, who's got low physical activity and a BMI of 27, as well as a waist circumference of 94 centimeter, right? So what's going to happen is, in terms of the program, in terms of the program rollout, right? A health coach from Discovery Health will get in contact with you if you form part of the, listed individuals from the 25,000. However, you would need to give us consent in order for us to be able to onboard you onto this program that we've recently implemented. And a Premier Plus GP will be advised of your eligibility through your health through health ID, so a summarized report through health ID. And then you would need to consult with, your Premier Plus GP to confirm the risk and eligibility, and also to confirm enrollment onto this program. And I just want to say this will not impact any of your day-to-day benefits. We as a medical scheme are going to fund for it from risk. So rest assured, if you do happen to be one of the identified individuals, it will not impact your medical savings or your day-to-day benefits in any way. Right. So let's just also look at how our program will roll out, right? So this is a 12-month coaching session program where it consists of 2 GP consultations and 2 nutritional assessments, as well as prescribed medication, right? Like I've just said, onto the slide, I just want to re-emphasize the fact that there is going to be a 6-month Premier Plus GP assessment where you are constantly monitored in terms of your cardiometabolic syndrome, where you're constantly monitored in terms of what you consume into your body, because the ultimate goal is to keep you as healthy as we possibly can. Yes, we're in a critical position. Everyone is in a critical position where we could not intervene as we would have anticipated. But now that we've got the opportunity and we've got the funds to do so, I think it's only fair for us to, help the people, help our people, because I believe that we've built, a long-term and sustainable relationship. So this is our time to actually give back to you, because we know that COVID-19 has impacted all of us in this call, whether financially, emotionally, or physically, or whatever state of mind that you're concurrently in, right? So it's a 12-month coaching session. This is what it consists of in terms of the basket of care, and it will be available as soon as a health coach has confirmed your eligibility as well as your Premier Plus GP. Then you will automatically be onboarded onto this program. And I just want to reiterate the fact that it does not impact any of your ongoing treatment, right? Whether there's diabetes, whether there's TP program or whether HIV program, you will still be eligible for any of those programs as well. It's just that this is just an additional standalone program to, help you become as healthy as you possibly can as well. So let's just quickly look at, our benefit updates effective the 1st of January 2020. Oh, am I moving too fast, T? Before I move further along, do you guys have any questions pertaining this program?
No questions have been posted.
Sorry, you were talking a bit fast, so I might have missed it. Who is eligible? Do you have to be at risk to be eligible for this program, or do you have to have a condition like diabetes or something?
Now you have to be at risk to actually be eligible for this. Yeah. So from the 25,000 individuals, they've already been identified, right? So it's just a matter of us, going into the new year and, starting with our onboarding process, right? So the 25,000 people that are at risk have already been identified. We've got a list, but as soon as the new year begins, we will then get in touch with each one that has been impacted by this.
Okay, and if they have diabetes, will they automatically be on that list?
Not automatically be on that list. The artificial intelligence model, if they have diabetes, then I'm assuming that they're already on a diabetes program, right? But if it's something that they're not aware of which I think it's quite seldom for me to say you cannot be aware of not having diabetes or having diabetes, right? And if that's the case, then we will automatically onboard them onto a chronic program. And if they also do form part of the 25,000 individuals, they will also be onboarded onto this program as well.
Okay.
So this does not impact any of your ongoing management treatment. I hope that answers your question.
Yes, thank you.
Cool, no problem. Any other question before I could proceed? T was still good?
All good.
Thanks, Mahani. Right, so let's just quickly look at our benefit updates for January, the 1st of January 2023. The international second opinion services, right? This will increase to 75% on all plans, excluding the executive plan. So what that means is that this provides an additional 312.50 USD cover per consult, as well as the chronic illness benefit from 2023. Formulary and chronic drug amount changes will be applicable. And then for your benefit limits, thresholds, co-payments, and deductibles will be increased in line with medical inflation. Some benefit limits remain unchanged as well. Second pillar, Discovery Health, combination of Discovery Health's unique network, clinical and digital assets to deliver the lowest price point per unit of cover within the industry. Let's just quickly look at how we have evolved within the hospital networks that we have recently implemented. Just going to quickly also take you back to the first implementation of our network association, right, which was the Key Care, where we introduced it in 2002 for lower cost of hospital access. 2009, we introduced the Delta option for efficiency discount option. 2016, we introduced the Smart series for optimal healthcare journey supported by digital tools. 2022, we introduced the Key Care Start Regional, right? This is for regional networks, right? So within the scheme, we've got over 1 million individuals or lives that are on our network option, where it comprises of over 170,000 form part of the Smart, over 450,000 form part of the Delta, and over 400,000 fall under the Key Care option, right? So the reason why I'm showing you this slide, right, it's because at the beginning of my presentation, I'm sure that you might recall that I have re-emphasized and reiterated the fact that, a part of our contributions, a part of our growth, right, has significantly been impacted by our top 5 growing plans that were attracting the young and the healthy. And as it is shown onto the slide, it shows you how these young and healthy individuals have been, digitally savvy and have been utilizing our digital tools to the best of their capability, as opposed to a normal Discovery Health individual. It also shows you an average age of this, young and healthy that I'm also referring to, right? So with this statistic, we've seen an immense growth within the organization where we've accumulated high number of reserves, and we've seen how these people have been digitally engaged, right? So we use the statistic to actually introduce a new dynamic smart hospital network, right? Where it guides members to a dynamic smart hospital for the highest quality of care. Because that's who we are, right? If we see a continuous behavior in a specific area, then we work towards, providing additional cover and benefit for those people that are in that position, because it's all about what our clients want, right? So how this dynamic smart hospital network will work is through your geolocation, so which means an area that you're currently in, diagnosis and health record, as well as provider data. So this is the most efficient smart hospital with the highest quality of care, right? So we are introducing the digital first essential dynamic smart plan, right? This dynamic smart plan, it is underpinned by dynamic smart hospital, right? So for any hospital admissions, this is the basket of care on your left-hand side of the screen. Any hospital admissions, we do obviously offer unlimited emergency cover. And then also there is also unlimited in-hospital cover for planned admissions as well, right? And it also comprises of list in terms of your day-to-day benefits. There is unlimited GP consults, limited dental checkups, eye tests, chronic medication, over-the-counter medication, and major medical, which is the maternity oncology and renal state as well. This new plan option is going to be only 1,450 per month. So this is the cheapest option that we're going to have on discovery, and it's also going to be available from the 1st of January 2023. Although it's cheap and it's quite attracting and so forth, right? But my advice to you would be do not form part of this plan option if you know that you're not digitally savvy, right? If you know that technology is not your first choice, if you know that you can't utilize our digital tools, then do not form part of this, right? And I'm going to tell you the reason why I'm saying all of this just after the slide, right? So how you would access your dynamic smart hospital would be consultation with the GP face-to-face or virtually, which is the smart GP. And then specialist consultation will be consulting a specialist associated with a dynamic smart hospital. And you can also visit a casualty at any smart hospital, right? For emergencies, all our members will be covered in full in any private network. And then the essential dynamic smart members, right, can use any hospital in the smart network with no deductible until the second quarter of 2023, when the full functionality of the virtual assistant goes live, right? Remember, it's a new plan option, so we have not fully implemented it. So what we're saying is, should you form part of this program from plan option from the 1st of January 2023, then you can utilize any hospital in the smart network, because it's going to have its own hospitals, right? Specific hospitals, but you can, utilize any hospital in the smart network. There will not be any deductibles that will be imposed until the second quarter. So from April 2023, when we, go live with the full functionality of the virtual assistant, right? So the reason why I've been saying that you need to be digitally inclined and digitally savvy to be part of this program, because this, in essence, is what's going to look like in terms of your every day to day when you need to get admitted, or when you need to see a GP, or whatever the case may be for your medical necessity, right? And the virtual assistant, let me just quickly take you through it, right? You will go through the virtual assistant where you would use the ask to find a doctor option, and then you would find a smart network GP, and then you're also able to book, consult virtually. And then if there is a specialist consultation that's required, a GP shares a link to finding a specialist, and then you choose your region, you confirm your region of care. This is the geolocation that I was referring to. And then we are going to recommend, providers that are associated with the dynamic smart hospital and that have a direct payment arrangement with us, right? And then you're also able to view your dynamic smart hospital for admission. So this is your everyday life if you need to get admitted, if you do form part of this program. So make sure that if you are interested into, having this program, that you are actually digitally inclined and you know how to utilize our digital tools, right? So with that being said, I just also want to give you, a clear comparison, right? As opposed to the industry or our competitors. So I'm referring to them as our competitors because we have to have some sort of competitors. But in all honesty, we as a medical scheme do not have any close competitors, right? So with regards to our competitors and the plan options in the 1,300 to the 1,700 price range, right? Let's just quickly look at the comparison that we have, right? So in hospital cover ratio, we as Discovery pride ourselves to announce that we've covered over 97% of in-hospital claims that have been put forward to us in full, right? So the remaining 3% would be people that, had deductibles, or people that were utilizing hospitals that do not form part of our network. But imagine if everyone else, follows the plan option guidelines and protocols, then we would have a clear 100% in hospital cover ratio, right? Which is very important and which is very significant. And I think this is one of the reasons why we're still number one within the industry, right? So let's also look at the industry, which is our competitors. They've got 93% in hospital cover ratio. And then let's also look at our core payments, in hospital core payments, oncology and maternity. So from our side, for this plan option, for the 1,450, right, we do not impose any in hospital core payments, whereas the industry would pose in hospital core payments that range from 1,500 all the way to 13,000, right? And then for oncology and maternity, we cover PMP and non-PMP, whereas the industry only covers for PMP conditions. And then day-to-day benefits, yes, we offer day-to-day benefits on this lowest price point per unit of cover plan option, whereas the industry does not, right? And then we've also introduced the Wealth Fund, where we give you an additional plus 2,500 per annum. The industry, they do not have any intentions of actually introducing an additional cover to you as a member. And I'll also be taking you through the Wealth Fund in depth as well, right? Let's also look at the third pillar, where we are investing our surpluses that we accumulated during the COVID-19 in the health of the membership base and the scheme to achieve long-term clinical and financial benefits, right? At the beginning of my presentation, if you might recall, I did mention that, we are currently in a critical position as a medical scheme, as we've seen a deficit, right? And this deficit was caused by, the COVID-19. People were not going to hospitals, people were not doing their health checks, people were not keeping healthy, right? Which is understandable. There is no one to blame for this, right? But at the end of the day, we need a solution, right? So this, when you look at the left-hand side of this presentation, it clearly shows you in terms of percentage, what sort of percentage we have for people that did not partake in health checks and mammograms as well as prostate screening, right? And then when you look at the middle of this presentation, it shows you what this critical position is that I'm referring to, right? We were not able to, detect early stages of cancer, right? As you can see, there's a skyrocketing number of stage 4 detection in terms of cancer and cardiometabolic syndromes, right? We've also seen that there was an increment of plus 10% prior to COVID-19, and since COVID-19 of complex of individuals, new diabetes individuals with complex conditions as well, right? And then looking at, how significant it is, or the significant screening has on an average or on a person's health span and lifespan, right? These are some of the cardiometabolic syndromes that you are seeing onto the screen, and they also have a lifespan as well as the health span as well. So you can see there's actually a decline in all of these segments due to the predicaments that we are encountering as what's this, as an organization, and for you as a member as well, right? But I just want us to shift your focus a little bit. Look at the further right hand side of this presentation. Look at how these numbers have increased in terms of what we are contributing towards our annual healthcare claims, right? Because of this, people are not healthy, and we are seeing that, we are monitoring that. So that's why we're implementing new plan options, we're implementing new programs to help you get back to shape, to help us as a medical scheme be able to maintain a healthier membership base, because we have a core purpose of making you healthier, enhancing and protecting your life, right? So we are working towards that goal, and we would, gladly appreciate it if you work with us to help us help you, right? So with that being said, this is just giving you a detailed breakdown in terms of how we're planning to have our targeted solvency, which is making excess reserves available for the long-term health of Discovery Health members. And then the 1.9 billion, we're using it now to defer our increment for next year in April, right? With that being said, I am introducing to you the Wealth Fund. This Wealth Fund additional cover is available across on all our Discovery Health plans. It will be available from the 1st of January 2023 for 24 months to all existing and new members of Discovery Health. So because there was a deficit in mammograms, prostate screenings, and so forth, right? So we are saying in order for you to be able to be eligible for this, you need to unlock this with a health check, right? And then we are going to give you an additional 2,500 Rand if you're 18 years and older for an adult dependent. And then for children who are older than 2 years, we are going to give them an additional 1,250. And then for a family, we are capping the limit up to 10,000, right? So the Wealth Fund is activated once all members on a policy age 2 and older complete an in-person health check, and in all health checks completed from 1 January 2022 onwards count towards unlocking the Wealth Fund, right? So the Wealth Fund is a once-off benefit available to all existing and new Discovery Health members, right? So once you activate this Wealth Fund from the 1st of January, just know that it's going to run through for the next 24 months. You're not paying anything for this. We are giving you additional amounts. We are giving you additional cover because we're concerned about, your health, and we're trying to get everybody back in shape, right? Because we know how deteriorating, the predicament that we all encountered has been towards our health, our emotional well-being, our physical well-being, as well as our mental well-being as well, right? And then once you've unlocked the Wealth Fund, any member on a policy can use any portion of the Wealth Fund, even when an allocation is not received. So what this means is we do not reserve any funds. Hypothetically speaking, say for instance, there is a family of 4 on the membership, and one person from those 4 individuals decides to use the full 10,000. So what this means is we do not reserve any funds. They work on a first come, first serve basis, right? So let's just quickly look at, a broad range of additional discretionary benefits from the Wealth Fund, right? So we will cover for your physical health, your mental health, your women's health, general health, men's health, as well as children's health. As well as children's health as well, all right? And then the Wealth Fund is not only restricted to only screening and prevention ICD-10 codes or claims. There will not be any network restrictions that are applicable. However, for members who are on smart and key care plans, must use an allocated GP for relevant services in the basket. And then there is no frequency limits that is applicable apart from the 1 GP visit per person. And then the certain clinical frequency limits that are applicable as per the current screening and prevention guidelines and as per your plan type as well, right? So how this Wealth Fund is going to work out with providing you with additional benefits is the Wealth Fund pays out after risk benefits and before utilization of discretionary savings, right? So 1, the Wealth Fund for screening and prevention, right? The Wealth Fund's benefits are paid out of risk before the Wealth Fund. And then for your maternity benefits, right? Wealth Fund is used before discretionary medical savings account. And then for your medical savings account is only used after Wealth Fund is being depleted, right? Let's look at the right-hand side of this presentation where it gives you the member journeys. It shows you a practical example of your journey. So what would be covered from the Wealth Fund and what would not be covered from the Wealth Fund. Say, for instance, you're doing a pap smear, your screening test will obviously come from your screening and prevention benefit, and then the consultation will come from the Wealth Fund. This has no impact on your medical savings or on your day-to-day benefit. This is just an additional cover amount that we are giving back to you as our member. And then for your discretionary benefits, which is the GP consultation, for instance, flu, the consultation will come from the Wealth Fund, and I just want to reiterate the fact that any of these covers do not have any impact or whatsoever upon your medical savings account as well. All right, just a quick recap. How you would need to unlock the Wealth Fund is by completing a health check. If you've done a health check in 2022, maybe through Discam or Clicks Pharmacy, then you are automatically eligible for this. Just send us a proof of your results in order for us to be able to capture this on system. Or if you've done your health checks through wellness days that were created by us as a medical scheme to your employer, then you are automatically eligible for this. And then you can also receive personalized, guidance for recommended screenings and track available funds on our Discovery app, where you can track your benefits. We can also recommend the next best action according to age and gender. You can also view your available health checks, and you can also book a consultation on the app as well. And then the plus bonus for members that are Discovery Bank clients, right? You guys are also able to see, the Wealth Fund basket of care, what in terms of what is available in your wealth fund, there is going to be an additional feature on your existing banking app, and then you'll also be able to see how much you have in your wealth fund as well. Right. Just also a quick summary and a recap of what I've been saying from the beginning of this presentation, right? So what we're saying is from the 1st of April, contributions are going to be deferred to the 1st of April. So we're not increasing from the 1st of January. And then the oncology thresholds increase by 25%. A new program, which is called the Disease Prevention Program, that has 25,000 individuals identified. Discovery Health Benefit Updates, which is the Dynamic Essential Plan, as well as embedding the Wealth Fund to give back to you as our member. With that being said, ladies and gentlemen, I thank you all for your time and patience. I am going to open the floor now to any questions. But before you can ask your question, I just want you guys to remember that at the end of the day, these are your benefits. This is your medical aid, right? Use this opportunity as efficiently as you possibly can to ask any questions, whether you've got any questions concerning the medical scheme or the existing plan option that you have, so that we can unpack it for you to avoid, having any discrepancies in the near future. Sue, I see you've got a question. Good morning.
Good morning. Thank you very much for that. Can you go back to the slide where you showed the impact of the testing on the breast cancer, prostate cancer, etc.? And you talked about years. I didn't quite understand what that meant.
Which slide?
This one, that one, breast cancer. So you've got breast cancer 22 years down. Does it mean you've increased your lifespan by 22 years or what? What does that mean?
Yeah, there's a decline in 22 years. So it means that you've decreased your lifespan for breast cancer. So this is, this is just
this talks about enhancements. This talks about individual life and health span enhancements. So I would presume that because you've gone and got tested, then you've increased your lifespan. But you're saying that if you have breast cancer, you're decreasing your lifespan by 22 years. Is that what you're saying?
I think I'm saying the exact same thing that you were saying.
Okay.
It's just that I didn't get the gist of the question. But yeah, exactly that. If you have actually been tested for this, then it means that you've increased your lifespan. But if not, then you've definitely decreased your lifespan. I'm sure that gives you comfort, Sue.
Okay, thank you.
Cool,
Talisa,
no problem.
We have another question from Portia. She would like to know, when does the oncology threshold increase?
From the 1st of January. That's when the oncology
thresholds and MSAs, etc., will increase and top up from the 1st of January, hey?
That is correct. That is correct.
Will there be another top up to those benefits from the 1st of April? Or is this the set benefits for the year?
No, that will be a set benefit for the year. It's just that the only thing that's going to change for April is just it's our contribution, right? We will also just give you guys an opportunity to upgrade your plan types should you wish to upgrade your plan types as well.
Okay, thank you.
So if you're already in your oncology benefits, so let's say you're on a saver option 200,000, so that will now go up by 25%. So if you're close to having spent your 200,000, then it'll just increase within the cycle.
That is correct, Sue.
Okay, thank you.
Cool, no problem. Any other question?
With the new smart plan that's being introduced, will it have the same co-payments for dentistry visits and GP visits as the existing smart plan, or will it have the same co-payments as a classic smart plan or the essential smart plan?
Yeah, for now, we're not in a position to actually advise on that based on, how we're trying to have an accurate pricing strategy. Like I said in my presentation, that for now, there's not going to be any, co-payments or deductibles, right? Because we're trying to still determine what the average percentage will be for our co-payments, right? And we're also trying to be in line with medical inflation and affordability. So that will be announced second quarter before the new increment that is deferred currently to the 1st of April. So for now, we haven't really, don't have a set percentage in terms of what we are going to increase this by, but there will not be anything. So in essence, members are actually getting 2022 benefits, 2023 benefits for 2022 contributions. So for now, there won't be any co-payments and deductibles for this plan specifically. Does this provide you with comfort, T?
Yeah, and sorry, one more thing. I don't think it was mentioned on this presentation because the price increases happened from the 1st of October, but what was the average price increase across plans?
The average price increase across plans was CPI plus 7.9%, I think. Stand to be corrected.
Okay.
Sounds a lot.
Sue, 7.9%, right?
That sounds a lot. CPI
It
plus
sounds a lot.
No, CPI plus 7.9% would be close on 13%. So I don't think
Yeah,
they went
no,
up
it's
that
actually,
much.
yeah,
I think it was going up by 5.9, I thought.
Yeah,
And I didn't
somewhere
do the
along those
calculation.
lines.
Can't be CPI plus 7.9. That would be extortionate.
Somewhere along those lines, T, but I'll just, check and
All right,
confirm
yeah,
it
if
for
you
you.
could check.
Yeah, I don't know it off by the top
And has
of my head.
the new essential plan, is the brochure ready for it yet, or when can we expect a brochure for that?
I will communicate with you closer to the time. The brochure
Okay.
is not ready as of yet, but you can also revert back to the presentation that I sent to you yesterday.
Sure.
It's got a few slides based on this new option, but we do not have a brochure ready for it as of yet.
Okay. Any other questions from the audience that you'd like to post? It doesn't have to just be about the specific presentation. If you maybe have a question around your plan type, you're welcome to ask it now. Oh, thank you, Lebo. Lebo says there was a 7.9% increase in October 2022.
Yeah.
Okay.
Portia
I
would like
remember
to
it was
know.
7 point something.
Okay, 7.9%. And then Portia would like to know, can you please just explain the co-payments again? I didn't quite get it.
So she wants me to explain the co-payments one more time. She didn't quite get it. You know what I'm going to do,
Cutoff
right?
for upgrades is the end of December.
It's the end of December.
Okay.
And on that topic, just a reminder that BDO will be closing on the 15th of December. So we would like your upgrades still in the month of November. So if you know your plan type, please send it through that we can have enough time to process the changes for 2023. So please do send your plan changes to BDO before the end of November so that we can ensure that you have enough time to change by December when we close on the 15th of December.
That is correct. Where's that slide?
Portia, is that especially when having reached the threshold, a follow-up from your previous question? So can you please explain the co-payments again? I didn't quite get it, especially when you reach threshold. I'm assuming that's how you would like your question to read.
Yeah, I think she's looking for this. I'm just looking for this specific slide that speaks to it. Just hold on a seckie. So Portia, there's a specific slide that speaks to our co-payments and cover from the 1st of January, right? Yeah, so this is the slide, right? So the benefit enhancements are effective. Benefits, limits, and co-payments and deductibles are increasing by 6%, right? The annual threshold is also increasing by 9.9%, right? This is for January 2021. And I'm sure, Sue, this also provides you with comfort, right? So from the 1st of April, upgrades will be allowed. Additional savings allocation before 1 April 2023 for members that, say for instance, members that want to upgrade their plan type, right? Moving from comprehensive to maybe priority. So you know that medical savings allocation is not the same, right? And then for members that have already reached the above threshold benefit before 1 April, will stay in the above threshold benefit. Key care income bands increase in line with salary inflation, and there's no key care income verification only over 2023. I'm sure that provides you with comfort in terms of the increment in terms of our co-payments and deductibles.
Portia,
Yes,
I hope
T?
that Portia, has that answered your question? Are you comfortable? Do you need more detail on co-payments and threshold? I'm going to assume that Portia is happy. Any other questions before we close off for today? Okay, sorry. So Portia would like to know more details for oncology. Portia, perhaps you and I can have a separate call. If Tabiso isn't able to answer your question now, we can set up some time separately. When it comes to the oncology, would you like to know what the thresholds are for the what the new oncology benefits are for the new year? Tabiso, I know there was a slide where you did actually show or is it in this presentation? I might be getting confused with something I read where it showed 2022 limits for
25.
oncology and 2023. I think oncology goes from like 200,000 to 250,000.
Yes, yes.
Is that on your
yes.
slideshow? Or is that somewhere else? where I
No,
read
it's
it?
not on my slideshow, but it's on the presentation that I sent to you yesterday, right? So there is a
Okay.
specific slide that shows you what the increment is about. You're right, it shows you what the specific amount is, but in terms of percentage point of view, it has been increased by 25%, the oncology threshold.
Okay, and that's across, that would be from your saver plan, priority, comprehensive, and executive?
All
or
discovery,
all discovery plans.
that is correct.
Okay. We have another question. Could you explain the difference between classic essential plan and classic saver? I assume there you mean the essential saver plan and the classic saver plan. Key difference would be that classic plans cover 200% of the discovery health rate, and the essential plan covers at 100% of the discovery health rate. That is where discovery does not have payment arrangements with the specialists, and they actually then would have that 100 or 200% agreement.
That is
that
correct.
answers your question, Janet. Diane, have the payment gaps increased on all plans, especially classic priority? Not sure what you mean by payment gaps. Could you just clarify that, please?
I think she's talking about co-payments.
When the MSA runs out. Oh, the self-payment.
Self-payment gap.
All right. To be still self-payment, that would have increased by what percentage?
It would have been by 6%. It's increased by also 6% also, yeah.
And that would be all priority, comprehensive, and executive plans?
Yes, that is correct. All plans that have this benefit structure of
Self-payment gap.
savings, self-payment gap, and above threshold benefit.
Okay.
Sweet.
Right. Any more questions? Okay, well, if there aren't any more questions, again, last time I do encourage you, if you do, okay, Portia, you want to ask a question?
What's happening?
Yes, I do. Sorry, I see typing is becoming of a mission, so let me just ask.
Sure.
Tabitha, what I want to ask is on plans. Like, I want to understand, when someone is rushed to an emergency or what, but then you're under the network, you end up paying, I think it's like the upfront cash, and then you claim later from Discovery. I just want to understand how does that work? Why is that? How does that work? If I'm under a plan and I've gone to a network that is in my plan, the DSP that is in my network, but if I'm rushed to the hospital, I have to pay upfront as an emergency. I just want to know how that works. I don't know if my question makes sense.
Yeah, I'm still trying to make sense out of your question. So you're saying it's an emergency, you're rushed into hospital, and then you pay. Is that what you're saying?
Yes, let me just give you a practical example. Okay, most of the time, let's say if I'd rush my mom to the hospital, right? Like maybe in the middle of the night or whatever, and then right then that I'll have to pay like maybe 1.5 or something like that. But yet it's in the network. I'm
What plan
within the
option are
network.
you on?
Classic priority. Classic priority.
And then you're paying within the network, and the hospital is one of the designated service provider.
Yes, and it has happened that to me twice.
No, T, I think we should look into it, because it doesn't sound right from my point of view and my perspective. It really doesn't sound right, unless, and you're also saying, you're mentioning something about emergency. So if it is an emergency on all our discovery plans, regardless of what the monthly premium is, we do cover for that in full, right? So it doesn't make sense that it was an emergency, but you're still paying a co-payment as well. I think that would be imposed in a position or in a situation where it is an elective admission and you did not let us know of the admission on time, and then let's say, for instance, you went and got admitted today and you loaded an oath today. That's when we can impose the non-notification penalty, and you would need to pay a co-payment or deductible. But in your scenario, it absolutely does not make sense from a medical aid point of view, and I think it's something that we need to look into from our end. But it shouldn't be that way. In future, it really shouldn't be that way. If it's an emergency, then you know that you're entitled to full cover in hospital. If it's a network issue and you're unconscious, you are going to get admitted get the necessary help that you can possibly get, because it doesn't make sense being in a critical position and now you have to go to a designated service provider when you can get help at the nearest private facility. You understand? So I think, Portia, you can speak to TT. Let's touch base and see how we can help Portia with regards to this, right?
Yeah, Portia, let's set up an offline meeting. Tabitha, myself, and you will be on the call, and we can pull up your claims transaction history and go through it and understand. I know it has to do with the admissions around your mom's condition, so we'll just we'll discuss that in more detail to understand specifically why that is. Because you're not on a network option. Like, for example, if you're on Delta or Smart, you would have been in a position where, you know, did it tick the tick box of is this actually an emergency? If not, then they would make you pay that upfront penalty for using a non-network hospital, but that's not the case in your situation. So I think it would be best if we take this offline and discuss it further.
Okay, thank you, T. Great, I would appreciate that.
Pleasure. Diane, have the rules changed for the benefits for spectacles covered every 2 years? No, those benefits have stayed the same. So your pap smears, your mammograms, your PSAs, those benefits are still the same every 2 years or every year as they've been. That hasn't changed. What is the difference between classic priority and saver? Is it the value of the savings account? That is one of the differences, yes. But the key difference is classic priority offers you a self-payment gap, which leads to an above threshold benefit, whereas classic saver does not have an above threshold benefit. So to quickly highlight what an above threshold benefit is and what a normal savings account is, your normal savings account is on plans from classic saver, priority, comprehensive, and executive. Those plans all have savings accounts. That's an allocation of money that you can use for your day-to-day benefits. For example, going to see the GP, getting over-the-counter medicine, going to the dentist, the optometrist. That's what your savings account is available for. Once that savings finishes, you are then in a position to pay for your day-to-day expenses out of your own pocket because it's now finished. On plans like Classic Priority, Comprehensive, and Executive, these plans, once your savings finishes, has a period where you go through a self-payment gap. And this self-payment gap means you've submitted proof of claims that you've paid for out of pocket to the medical aid. Once you've reached the cap that you're supposed to pay out of your own pocket, you have access to an above threshold benefit, which is sort of like a second medical savings account, but with a few more rules that apply to it. It's not as open-ended as a medical savings account. I hope that has answered your question.
Talia, can I send you an email just asking for a comparison between my current plan and one of the plans that you mentioned?
Yes, of course, definitely.
Okay. Thanks.
Any other questions? Okay, well, thank you very much for being an attentive audience. Thank you for all your questions. I think it does help the people who are shy to ask questions. I hope that your questions have been answered. Again, just a reminder that if you do have any questions or something wasn't clear, you're welcome to reach out to us and we can take those questions further offline. And last reminder that our upgrades, although Discovery is allowing upgrades until the 30th of December, we as a company are closing on the 15th of December. So we need your plan changes submitted to us by the end of November, please, to ensure timeliness processing. Tabitha, thank you so much for your presentation. It was very informative and it was to the point. So thank you for that.